చెప్పండి. So listen carefully. We are starting new topic which is called as circulatory system. Yes or no? So exactly is what are arterioles, what are capillaries, what are venules, what are veins, what are how the cycle is going on. Yes or no? Yes or no? Now we should know what is this blood circulation. We should know what is this blood circulation. How the blood is entered into the lungs. How pulmonary circulation. We call it as pulmonary circulation. Now, blood being distributed to the entire parts of the body. Blood being distributed to the entire parts of receiving to the heart. You call it as systemic circulation. We call it as systemic circulation. Now, when as we have seen during the arteries discussion, blood vessels discussion. So I told you what kind of artery is going to what kind of place and how the venules are arranged. Yes or no? Yes. For example, you take your upper limb. You take your upper limbs. So upper limbs, what is ascending aorta is coming? Yes or no? Ascending aorta is coming. Yes or no? Yes. So from ascending aorta, subclavian vein will arise. What is arising? Subclavian vein. From subclavian artery will arise. What will arise? Subclavian artery. So from subclavian artery, what is arising? Axillary brachial. From brachial artery, what is arising? Radial. Deep palmar arch and superficial. From deep palmar arch and superficial palmar arch, digital. This is the artery supply. Supply is also there. Yes or no? Yes. Is there ulnar vein? Is there brachial vein? Which is distributed to superior vena cava? Which is distributed to superior vena cava. Now, how it is there for hand? Same way it is there for your stomach. Same way it is there for your brain. And again in brain, how the circulation is going on. In brain, how the circulation is going on. So we will see what is aorta actually and how this aorta is distributed. What are the branches of aorta? What are the branches of aorta? How it is distributed again? What is arch of aorta? What kind of arteries are arising from arch of aorta? What is descending aorta? What kind of branches are coming from descending aorta? What is ascending aorta? Nothing but when you take the heart, so when you take the heart, this part is ascending, going upward, so you call it as ascending aorta. You call it as ascending aorta. Now, after ascending aorta, the aorta is bent. So bent, this structure is resembling like a arch. This structure is resembling like a arch. So that's why I'm calling it as arch of aorta. Now, this arch of aorta, I'm observing kinda back kinda inka kinda clear ah pike illam observe full ga pike okay leave, no problem. This arch of aorta to where it is supplying? It is passing to the diaphragm. Yes, sir. It is passing through the diaphragm. It is passing through the diaphragm. From diaphragm, it is supplied. Here it is supplying to the thoracic organs. There it is supplying to the abdominal organs and pelvic region. Then it is supplying to the lower limbs. It is supplying to the lower limbs. Yes or no? Yes, so here this aorta is going up or coming down? Coming down. So here it is going up, that's why I called ascending. Here it bent, that's why I called arch. From here it is coming down. So what we should call? Descending aorta. Now you understood why it is ascending aorta, why it is arch of aorta, why it is descending aorta, what it is divided. From arch of aorta, what is dividing? From descending aorta, what is dividing? We have step by step. Remember, this is just an introduction. I am just trying to give an introduction. In next class, I am going to teach you step by step with proper diagram. Step by step with proper diagram. Now listen to me. What is the circle of Willis? What is this? Circle. So circle of Willis means nothing but the blood supply which is there in the brain. The blood supply which is there in the brain. Yes or no? Yes or no? Yes or no? Yes. Now from the arch of aorta, from the arch of pipelines here, we have three types of pipelines. So first one is brachiocephalic artery. First one is what, ma? Brachiocephalic artery. Next one is from brachiocephalic artery. It is divided into right subclavian vein and right common carotid artery. Right common carotid artery. So this diagram is not showing you properly. I'll show you tomorrow. Okay. Tomorrow when I'm coming to class, I'll bring the diagram and I'll show you. Okay. Now, whatever the second structure is there, left common carotid artery. Now, carotid arteries means nothing but the arteries which are going to your brain. The arteries which are going to your brain. Arteries which are going to your brain. So they pass from the neck region and they enter in. They pass from the neck region and that we have thyroid artery which will supply the thyroid gland. We have thyroid artery which will supply the thyroid gland. We have lingual artery. We have what, ma? Lingual membranes of mouth. That to be yes or no? Your face also. We have occipital artery which supply to the posterior part of the head. Which supply to the posterior part of the scalp. Next one, we have artery which supply to temporal portions of the scalp. So these temporal regions, these are the temporal. Now frontal, which supply the frontal side of. So do you get my point? Yes or no? Now we have circle of Willis. We have circle of Willis. This supplies the this supplies the blood to the brain. This supplies blood to the brain. This supplies blood to the brain. So how the blood supply is done to the neck, how the blood supply is done to the external surface, how the blood is given to the main brain, we will see. And we are also going to see the venous written from the head and neck. Head and neck. And next we are going to see the arterial supply to the upper limbs. Arterial supply to the upper limbs. I think I have already said to you what is the arterial supply to the upper limbs. Yes or no? Yes or no? Yes, so from basophilic artery and common carotid artery, they are arising. From there we are getting what? This one. What one? Clavial artery, subclavian artery. From subclavian artery we have axillary artery. We have what, ma? Axillary artery. So from these axillary arteries, they are further divided. They are further divided. How it is divided into circumflex artery? How it is divided into like deep brachial artery? What is superficial brachial artery? What is radial artery? We are going to see step by step. We are artery. What is subscapular artery? So all these things will be said to you clearly in the coming class. What is the time? Then why they are leaving? Okay, listen. So we know. Then one more thing what we are going to discuss is we are going to discuss the blood supply for the thorax. The blood supply for the thorax. So what is this thorax? Now arch of aorta came, yes or no? Arch of aorta came or not? Yes, sir. From arch of aorta, there are different types of arteries which are coming out. We have superior intercostal artery, we have deep cervical artery, we have ligamentum associated arteries, we have coronary arteries. Now mediastinal branches, which were supplying to the thoracic cavity. We have thoracic aorta. We have thoracic aorta. Now major artery. Now anterior is there, posterior is there. So we have posterior intercostal arteries. We have